My name's Louie and I'm a neurological physiotherapist and a clinical academic. I'm based at University College London. In my research and for my doctoral work, I was looking at neuromuscular diseases as an umbrella term, so looking at kind of most of the neuromuscular diseases, not including things like Guillain-Barré syndrome or myasthenia gravis, but looking at certainly muscular dystrophy, so limb-girdle muscular dystrophy, FSHD, congenital myopathies, but also looking at neuropathies like Charcot-Marie Tooth disease. The reason is that my research is looking at partly about the experience of living with a neuromuscular condition, but also looking at ways that we can support people to try and live well with one of these conditions. As there's no cure for most neuromuscular diseases and even no treatments, it means that there's kind of a pressing need for us to try and develop strategies to help people to develop things like knowledge, skills and confidence to self-manage their condition until we do have more tangible treatments for them. Self-management support is now a kind of central pillar in the management of many long-term conditions in the UK and internationally to a certain extent. I think probably it's more in higher income countries that we're looking at self-management support as an important construct, important way of supporting patients. Basically, as we're seeing, aging populations, we're seeing more and more people living with long-term diseases. It's become, almost a part of routine care in conditions like diabetes, hypertension, now in neurological conditions like stroke, in Parkinson's. So there's lots of research in all these different areas. If you think about neuromuscular diseases, they're a very specific, type of conditions, and often they're progressive. For most, there's no cure, limited kind of treatment options. There's the fact that they're rare. So there's lots of these kind of complexities and kind of contextual nuances that I kind of felt were very important when you're kind of thinking about how to support these people to self-manage with their conditions. And I was doing actually some other research looking at balance rehabilitation in Charcot-Marie Tooth disease, and I found that actually there's very little research looking at the construct of self-management support in neuromuscular diseases. So that's when I put together my PhD proposal, which was mixed methods exploration of self-management support from the perspective of people who live with neuromuscular diseases. We wanted to have some kind of an intervention, so something that we could actually do with patients that would actually help them, so that was really important. So we decided to adapt an existing self-management support program called Bridges, which is essentially an approach that's based on something called social cognitive theory, and it's really, in kind of simple terms, it's about supporting patients to develop knowledge, skills and confidence to manage this kind of day-to-day challenges of their condition. And it's been shown to be, a useful intervention in conditions like stroke, traumatic brain injury. But obviously, again, neuromuscular diseases are very different. So it was important for us to adapt the Bridges approach. So we used kind of co-design methods, so including patients and clinicians, getting them together in workshops, and tailored this pre-existing support intervention specifically for people with neuromuscular diseases. And so then we have this intervention, we want to start seeing how it works. But I was very keen for the evaluation to be kind of rooted in the priorities of the people that actually live with the conditions, rather than it being about clinical outcomes that we had pre-decided. I think there's an implicit kind of value statement in how you choose outcomes. If I'm picking an outcome, it's me saying, this is what I think is important, but I think there's important for kind of to be rooting the outcomes of research in the priorities of patients. So in order to do that, the first stage of the PhD work was actually a big qualitative study, basically designed to kind of gather the narrative of what's important to people with neuromuscular diseases from a self-management perspective. So we talked to them about barriers and challenges to self-management, experience of support they'd received in the past, their priorities for how they would want self-management to be delivered and how they'd like to receive it. Things like how they set goals and plan for the future. And although the original aims of that study were to really inform design features of the evaluation of the new intervention, what I found is that the data was so rich and nuanced. The conversations I had were absolutely fascinating, and I felt that the kind of those conversations warranted kind of deeper exploration. And so although we did get lots of useful information that we then wove into the evaluation of the neuromuscular version of the Bridges self-management intervention, I've also kind of developed a bit of a working model of adapting to life with neuromuscular disease.